Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and in this video we're going to overview Jones fractures. A Jones fracture is a subtype. It is a smaller portion of what we call a metatarsal fracture. Metatarsals are these 5 long bones that come across the middle portion of the foot. They connect our ankle and our hind foot up through the ball of the foot and into our toes. They are long stabilizing bones of the foot that help us propulse and move ourselves forward. All metatarsal fractures, all 5 of them, compose somewhere around 5 to 6% of our body fractures. So every fracture in the body, 5 and 6% of them are going to happen down here in the metatarsals. Of foot fractures, metatarsal fractures happen somewhere around 35 to 40%. So in terms of foot fractures, they're really pretty common. And of the metatarsal fractures, the 5th metatarsal, this one out here on the outside portion of the foot, this one happens somewhere around 55 to 70% of all metatarsal fractures. Now these 5th metatarsal fractures, they happen in all ages, but really that's kind of predominantly in those aged somewhere between 20 and 50 years old. They also happen in pediatric fractures, and they do occur in just over half of all of our pediatric fractures. These fractures typically happen from twisting motions, from kind of an ankle inversion motion, from spinning motions. And this is what happens a lot in the NFL or football, basketball, NBA players get this to happen too. Soccer is another common sport for this to happen. And because these fractures happen in the NFL, in the NBA, and in the soccer world, they get a lot of notoriety for injuring these players. Well, when we look over here on our computer screen, we're looking at what is a 5th metatarsal. Bear in mind, this is a pediatric 5th metatarsal. You can see how we have an open growth plate up and through here. That is not a fracture. This picture is also great in showing us too, we have a secondary growth plate in the 5th metatarsal that likes to hang out on the outside. This is not to be confused with a Jones fracture as well. Jones fractures happen right in this little pinkish portion on our chart here, where they happen outside of the joint space and before the long shaft of the 5th metatarsal. The reason why this is important is right in this little pink zone is what we call a watershed. This is an area that doesn't have good blood flow. Don't ask me why it's called watershed. It sounds kind of opposite, but there's just not good blood flow in this area. There's something between 30 and 50% less blood flow in this area. So as we disrupt the bone with a fracture, we're gonna really kind of sever some of that blood flow into the area, leading to a high rate of what we call non-union or fractures that don't heal. Those fractures that are treated conservatively, somewhere between 15 and 20% go on to just non-healing by themselves. So it's really important for us to address these things. Surgical management of this fracture drops it down to somewhere to 3 to 5% non-healing, but there is still significant risk with it. So if you're having a Jones fracture or think you are and you come into our office, what we're gonna do is we're gonna take an x-ray of you. We're gonna see if this is a break. Whether it needs to be fixed conservatively or surgically depends on a lot of different things, and there isn't a full consensus in the medical community. Age, activity, shape of the fracture, displacement of the fracture, these things all matter on whether we can do conservative versus surgical care. I believe, and in my office, all patients, we're gonna try to sign you up for what's called a bone stimulator. This is a little ultrasound device that we put on the outside portion of the foot that sends healing signals into the bone to help increase the bone healing rate and speed. This helps us defy some of our statistics and get better outcomes. If we have to treat you surgically, then typically what we do is we come in to the operating room, a lot of times just percutaneously, meaning with a very, very small incision, we're able to put a screw right down the length of this 5th metatarsal bone. The idea is to span across the fracture, to bring both sides together under some compression, and to really let that blood flow heal in the best way to get that bone going. Typically, if we're taking you to the operating room, it's around 7.5, 8 weeks to get you back into sports and into your normal activities. Conservative care might be a little bit longer, again, just because this area doesn't heal so quickly. Either way, whether we have to treat you surgically or conservatively, we're gonna take multiple x-rays, we're gonna check on your symptoms, we're gonna make sure that we're offloading the area appropriately and getting this thing to heal. Then we're also gonna use orthotics, maybe some physical therapy, maybe some sport-specific shoes to help you get back into your activities and not have a Jones fracture being a lasting effect for you.